I welcome all of you in my today's video that is regarding the second part of the pleural effusion. So what test can we do on the pleural fluids? Actually, there are two sections of today's lecture. One is the investigations that we do on the pleural fluid, and the other is indications for chest tube, that is chest intubation. So the first thing is RE. We already discussed in detail in the previous part first of pleural effusion that how RE can help you in identification of pleural effusion, whether exudative or transudative. So in RE we look for the cells, the LDH and protein, and all of these help us in classifying this, whether this is a transudative or exudative, and that help us to find out the cause, and of course help us in treatment of that patient. Now the pH. Normal pH of the pleural fluid is more than 7.40. If it is less than 7.40, and there is exudative effusion, think about empyema. And this is one of the indication for chest intubation. If the pH is less than normal pH more than 7.40, abnormal less than 7.40, and that means there is pus collection, and pus collection in the pleural space is called empyema. Next thing we can do is culture or gram stain. If it is bacterial, it will show us exact bacteria and sensitivity. The gene expert and acid-fast bacilli for tuberculosis. The gene expert can tell us whether there is mycobacterial infection or not, and the second thing, it can tell us about the resistance, whether there is resistance or not. Cytology can help us in malignancies. If there are abnormal cells, can help us. A malignancy is the cause of effusion. Amylase level can tell us about the pancreatitis, because we know that pancreatitis can cause effusion. The cholesterol level and the triglyceride level help us in cases of chylous pleural effusion. So these are the tests that we do on the pleural fluid.